In healthcare right now, cybersecurity is no longer just an IT issue. It's hitting operations, it's hitting finances, and in many cases, it's actually directly impacting patient care. So over the past several months, we've been sitting down with healthcare executives, security leaders, and we also partnered with EY to run a national survey. And what we heard was really eye-opening. We want to share some of the biggest takeaways from that research with you. So 3 numbers really stood out to me. First, 60% of executives said that their organizations experienced moderate to severe care delivery disruptions from a cyber attack in the past 24 months. And most of these came through third-party systems. Secondly, 86% of organizations reported 2 or more impactful cyber events or incidents at their organization in just 1 year. And then a third is that executives told us while they feel empowered to fund cybersecurity, there are still major gaps in turning that funding into real strategy and execution. So together, these numbers really make it clear. So cyber risk in healthcare isn't rare, it's the daily reality that we're operating in. When care delivery is interrupted, cybersecurity becomes a mission issue. Healthcare's vendor ecosystem really makes us uniquely vulnerable, as a single weak link can ripple through the entire system. And leaders have shared with us that one way that they're tackling this is by doing tabletop exercises that include their top vendors, the ones that they have the biggest strategic partnership with, that would have the biggest impact on their organization if something was to happen to them. That way, when something happens, everyone knows their role, how to respond, and if your vendors aren't part of your playbook, then you really don't have a playbook in your response and your recovery to a cyber event. Another theme we heard loud and clear is identity. So identity and access management has become a front line of defense, and it's not just your people anymore. It's your bots, it's your service accounts, it's even your AI agents. Leaders in our forum said that they're starting to audit every non-human identity and really ask 2 simple questions. Does this account still need to exist? And who owns it? Every identity needs an owner, and if there's no owner, then there's no account. So here's where leadership really matters. Many executives feel like the money is there for their cyber investments, but execution is lagging. One cybersecurity leader even shared with us that they've become the chief information screenshot officer. So they really feel like they're spending more time feeding auditors than really improving security. So how do you make cybersecurity a true priority when there are so many competing demands? A big takeaway as we explored this with EY is to really tell the cyber story in a language of your audience. So for financial leaders, it's really all about the cost, the downtime, and the recovery. For clinicians, this is about patient safety and uninterrupted care. So for boards, it's about monetary responsibility and resilience. And the other key here is that cyber really can't sit on the shoulders of the CISO alone. The best organizations are treating cybersecurity as a shared responsibility really across the leadership teams, the vendor partners. It's really everyone's job. So the bottom line here is that cybersecurity in healthcare is not just about protection, it's really about resilience, and it's about enabling the innovation, and it's about safeguarding patients. Leaders who succeed here are the ones who align their funding with strategy, who anchor their messages to what really matters to each part of the business, and who are creating a culture of shared responsibility. So compliance is really a byproduct. Resilience is the goal here. Don't forget to like and subscribe if you enjoyed the content today.